the third thing that we were kind of discussing was a way to evaluate one's own performance from the point of view of the physician. So looking at some data that could tell a physician, you know, in the last week or month, this is how many surgeries you've averaged on a day of surgery. This is how many complications you ran into while you were doing this, and then maybe a little bit of a comparison to how other people on your team have performed. And this might be a way of helping people, you know, gauge how well things are working and identify areas that they need to improve on. And maybe it's somewhat of a motivation tool to make
will it be the other way around? Will it make a depression also?
Will it make a
some
negative
of them,
impression?
Yes. No, I'm just asking.
Yeah.
Because some of them may be very good in surgery.
Mm-hmm.
Some of them may be very good as a human. You know, they're very well respected by the patients.
Sure.
So sometimes when you say you're not that good in surgery, the other man is good in surgery, the other man may not be a human.
Sure.
You know, so there are some plus points and minus points. So how do we? It's quite a sensitive issue.
And
I don't know whether you're able to understand the point. For example, I know one doctor here. He's a very good person. As a person, he loves to work. He loves to do. But his surgical thing is not as great as his personality. And I don't think he would like to hear that you are not good in surgery, because his other things are so good, he will win the other doctor.
Yeah.
So I'm afraid, I'm just saying it. You have to say, that's one of the measurement. Compare, when it is compared, for example, this you are talking about the senior level people. There is one senior doctor here who is with us for the last 15 years. He loves to go for an outreach program where most of the doctors don't want to go, traveling 8 hours in a bus in a hot weather. But his surgical output is much lower than a person who doesn't go. So how will you compare with one skill alone? My feeling is, if a person is good in this, little less in this, it's okay. But suppose the other man doesn't want to go to a camp, because one of the criteria or one of the strength of Aravind Natchair system is its community outreach program. It's a very, very intense, tough. Every weekend you have to go, traveling about 10 hours in a hot, non-air conditioned bus, stay in an ordinary community, see 1,000 patients, very, with a very good attitude, and travel another 10 hours, coming back to work on a Monday. That needs a lot of energy, willingness, hard work. The other man, he says, no, I don't want to go to camp. I'll rather do surgery because it's much more, I'm very proud. I don't want that doctor to feel, because I like the community outreach program, man, because he is a man who really enjoys seeing the patients, but maybe he doesn't want to do more surgery. But we don't have anyone to go to the camp also. So the measuring tool cannot be surgery alone. The measuring tool has to be, his research, his publication, his output, his attitude towards the patients. Just suppose if a man is doing 100 surgeries a day and if he's not a human, and if the patient says, no, I don't want to see the doctor, he may do a good surgery. But that man, I won't consider him as a tool. All I need is, there are some people who are very good and some people in certain ways. So we have to consider that aspect also as a tool and not only the surgery.